Val said, this day is for us to explore that aspect of our work, our lives, who we are, and how do we put action to that. And as we were trying to contemplate what this day how it would best be organized for you, every year my sons and I go fishing up in Canada. And we usually go to Ontario, and we put in the address of the resort, and we wanted to go up through the UP, up through Wisconsin, and then cross the border at Sault Ste. Marie. And so we put it in there, and we had a Google Maps as well as Apple Maps. And we wanted to see northern Wisconsin and the UP. But the app wanted us to go through Michigan. We didn't want to go through Michigan. And we had all this technology telling us, you need to go through Michigan. And we didn't want to go through Michigan. And we must have driven 30 miles with this damn thing saying, turn around at your next exit. So we eventually got to where we wanted to go. And here we are. And if you want to really connect with your kids, particularly when they're older, get them on a boat, right? That's one way to get them to talk to you. But we had a great time. We caught fish. We got to know each other better, as we always try and do. And it was a very meaningful time together. And as with most of us, when we refresh and we go away and we come back and we're energized to do our work, I came back to this. Diagnoses for my patients, and when I had my type 2 diabetic come in, it had me go through, boy, it must have been 50 of these questions. Type 1, type 2, okay, I got started pretty good, type 2. And then it started to go into, oh my gosh. It asked me if they were in a coma. I said, well, how many of our diabetics are in a coma in our outpatient clinic? And then it went through 7 different types of neuropathy. And I got so frustrated. It took me so long. And what was I doing during that time? What was I looking at? The damn computer. And who should I have been looking at? A human being. And it took me so long to go through this. If they didn't have neuropathy before the visit, they probably had it at the end. So I was frustrated because it was distracting me to what really matters. And that's this human connection. So that's what we're going to explore today. This was published in JAMA. And Tom Murphy wrote a beautiful editorial in JAMA about the picture his 7-year-old. How would you feel if you were the doctor in this picture? Where's the doctor? He's over there in the corner. So, we know this technology is a beautiful thing, but we have to get smarter with it. And that's what we need to explore together. And I am just so humbled by the expertise and wisdom we have in our department, but I'm also really optimistic about how much opportunity we have to really make significant change. It takes a little bravery. It takes a little guts, because we're going to try and shift the culture. And we can do that within primary care. We can together. And that's going to be an interprofessional process that everybody within the whole system works together towards, which is a lot of fun. And that's going to help us really honor our name transition to community health. Because you can't do one without the other. You can't do individual health without the health of the community. You can't do the health of the community without the individual health. So there's this reflection between the whole we and the whole me. So this is what excites me the most. And it makes sense that our medical system has really been focused on disease for a long time. It makes complete sense. But now, because of our $3 trillion a year medical system with very poor outcomes, we're starting to realize that we may need to make a shift. The head of Health and Human Services has now said that 50% of how we pay clinics through Medicare and Medicaid, 50% will be based on value, not volume, by 2018. That's 2 short years from now. So the challenge is, this is gray, right? Creating health in complex systems is very gray. How many catheterizations I do or punch biopsies I do, oh, there, it's very easy, right? There's a widget for that.
So this is why this process is going to be so difficult, is because this isn't black and white. Human beings cannot be just easily put into a diagnostic code. It is much more of a challenge. So we need to really shift our awareness. We're going to talk about this middle circle, this awareness. How can we drop in and really understand what the patient wants? And how can we support that in their journey? So we're going to bring this balance, right? We do this really well. We do this really well. We don't do this well at all. So here's our opportunity, particularly in primary care and community health. Here's our opportunity to create a new excellence in salutogenesis, how complex systems heal. So this comes from a grant we got to work with the VA, where they're shifting the largest health network in the United States towards one where the veteran is in charge of their health destiny. If you use a military metaphor, what's your mission for health? What do you need to be successful in your mission? And what support do you need to be successful so you can succeed in your mission towards health? So it's a three-step process. On the right, we have it for the individual. On the left, we have it for the community or the family or the we or the workplace. This morning, we're going to start over here with the me. This afternoon, we're going to explore the we. So the three-step process is first, in the middle, you drop in. John Kabat-Zinn says, when you enter that room or you greet that patient at the front desk, you drop in. You get out of your clutter. You drop in to what's most important in that place where anything can happen. This place of liminality or suspension. It can go one of 100 ways. What way do we want to go when we drop into awareness with that other human being? And if it's just about my agenda, they're not going to do it. We have to honor each of our own meaning in our life. So that first question is, what really matters to you? That's the middle. What do you want your health for? Then if you look at all the evidence for how complex systems heal, there's eight core ingredients that if we choose any one of these, it's going to improve the ability of our body to self-heal. Nutrition, meaning and purpose, our physical environment. Do we live in a healthy world or a toxic world? All these things really matter. So the first question is, which of these do you feel you need to work on first? Which of these areas do you feel you need to focus on first? And then the third question is the support. What professionals in our system, or in your own system, best friend, family, dog, nutritionist, psychologist, social worker, what professional do you need for us to recruit on your behalf for you to get where you want to go for your health journey? It's putting the patient in control of how we can serve their process. And then we use our expertise and our training to say, hey, well, the research shows maybe you should go down this path as well, right? But at the VA work, they told a beautiful story. One of the administrators at the Dallas VA said a veteran came to him really upset. He said, every time I enter this health system, everybody nags me about stopping smoking. Every single one, and it pisses me off. Because no one's taken the time to ask that cigarette is the only thing that is standing in the way of me and putting a gun to my head. No one stopped to ask. Everybody said, hey, you need to stop smoking. But no one dropped into awareness and really understood what that person needed to be well. So that's why we're going to explore this a little bit today and a little bit this morning. So if we look at the evidence of these things, right, these 8 core areas, it is overwhelmingly positive. Health is much more about what we do than what we take, by far. So if we're going to really influence the health of communities, we have to work on behavior. And that's what a lot of our department really excels at in research, is understanding how do we shift those behaviors. I'm just going to run through some of this research. These are 4 ingredients that are encompassed within those 8 wheels of health. Don't smoke, exercise, eat good, multicolored whole foods that were recently alive, limit alcohol. That's pretty simple. If we look at the research of who did those things versus those who didn't do any of those things, It's pretty remarkable. Look at the Nurses' Health Study. 84,000 nurses reduced the risk of coronary events by 83%. Health Professionals Follow-Up Study, 87% reduction in coronary artery disease. Women's Health Study, 71% reduction in stroke. And the EPIC North Fork Study added 14 years to someone's life. The evidence is overwhelming. But how well does it work if we just tell someone you need to stop smoking? Right? We all know this, that we have to go into the patient's meaning and use their motivation towards empowerment, towards a different outcome. So this came from the Napier group, and I love this when I heard them tell this to us as they came in and consulted for our department. Trust equals intimacy times competency divided by degree of risk. And this just resonates so well that we got to know our stuff, right? We have to be competent. We have to know the evidence. We should be aware of the evidence-based guidelines. But if that's all we do, we're going to be really bad at influencing outcomes. We need intimacy. We need to really feel and understand how we can do this together with another human being so we really honor that meaning that drives action. How do we do that? So we started to do this in our own clinic. And initially I was, anytime you shift the culture from, all right, here's your annual visit, all right, here's your mammogram, pap smear, your immunization's up to date. I had a patient that came in recently that I said, oh, you're pretty healthy. Let's just focus on what matters to you. And I just turned away from the computer. And I said, what do you want your health for? And it shifted that whole energy. And she started to speak from her heart in a way that was so rewarding for me that I left that annual physical exam with a joy in my step. Lisa Grant in internal medicine, she did this after grand rounds that we did in integrative medicine, and she sent Adam and I this email. She said, I had 3 physicals this afternoon, and I did the shoulder-to-shoulder technique with one person that was very moving. We're going to do that later. This was an elderly Muslim lady who I have worked with for 13 years. She doesn't speak English. She has congestive heart failure, which has been difficult to manage. With the translator's help, I asked, what do you want your health for? She said she wanted her health so she could do her formal prayers. She can't do them because the diuretics interrupt her prayers and take her to the bathroom. Then she's unclean and can't pray. Wow, we covered more in 5 minutes than we had in 13 years. Just the process of shifting what matters to you. And then how can we use this tremendous system to be in service of that? So there's some models that have started to do this. The NUCA model, the South Central Alaskan model, they gave their whole healthcare system to the Native Americans in Alaska, and they said, what do you want your health system to do for you? And they said, I want them to listen to what I want. And I want an ongoing, continuous healing relationship with an interprofessional team that helps me get to where I want to go. And they shifted their whole system to have it patient-directed. And let's look at some of the outcomes. I went and visited them. David Lessons is one of our graduates. He's working there now. Will Eby is the medical director. He gave me a tour. And this is their outpatient health system. And I'm taking the picture from the hospital. And after implementing this system, they had a 50% reduction in ER visits, 53% decrease in hospital admissions, 65% decrease in referrals. And look at that, customer satisfaction. That's value-based care. That's value over volume. And what they did is they really shifted their whole system to honor an active participation of the patient. So that person needs less passive things, right? Our medical system now, looks at the person as an inanimate object that we just give things to, right? All right, you need more drugs. You need more acupuncture treatments. You need more massage. Those are all passive treatments. They can be very helpful, right? We're not belittling them. They can be really helpful. But if we do that without the active participation of the human being, we're lost, right? Because we're not empowering them to make these changes that really dictate the health outcomes that we want to see. So, have you seen this Dr. Watson? Pretty powerful computer. This Dr. Watson beat the 2 all-time money winners on Jeopardy. I mean, they asked it the question, and this is actually WellPoint Insurance has put this computer in many of the primary care clinics across America. And in the future, I'm not going to have to look at that immunization list anymore. You know, the United States Preventive Task Force has an app where you can just enter everything and it tells you what you need. I don't want to do that. It drains me. It's boring. We have computers that can do that, but what is it that computers can't do that only human beings with blood going through our veins can do is really connect in a deep, emotional, intimate way. Intimacy is what we do much better than that computer. So you may have seen some of the literature that the annual physical exam should go away. The American Cancer Society said we should never not do breast exams anymore. You see that? So what should we use that time for? I haven't thought of a good name, but this is just one that came to mind. The Super Empowerment Meaningful Action Visit. I don't know. But this afternoon, we want you to figure this out, right? How can we do this? How can we figure this out together in our own place-based culture? Madison, Sun Prairie, Portage, right? I learned that's the correct way to say Portage. And what feeds us most in this work, whether anybody, your receptionist, your administrator, it's that human connection. That we need to first do this for ourselves, then we do it for the people we serve, and then we come together and we decide on an action towards health. And we need to create the time and the place to do this. So this comes from the Institute for Alternative Futures. These are people who predict the future. And what they're predicting in medicine is that the old model is this exhaust cloud, that we wait for everything to break, and then we try and fix it. That's kind of been our tradition in medicine. But what they're saying in the future is that we're going to have this aspirations model that resonates more with health, is what inspires you in spirit? What gives you meaning and purpose? Definition of a spirit. A connection that gives life meaning and purpose. Let that drive what we do. And then that's more likely to get people involved in making these tough changes that really influence the outcomes the most. That's the aspirations model. I was just attending at UW Hospital, and I looked at this guy's problem list. How would you feel if you opened up my chart at home, which you can do now, and you looked at your problem list, and you saw all this? Diabetes, fibromyalgia, insomnia, heartburn, dizziness, hemorrhoids. I'm a mess, man. I'm a problem. How does that make you feel? How does that make me feel as a clinician? Oh, God, no way I can fix all these things, right? This is the exhaust cloud. This is why we're seeing so much burnout in primary care, because we're trying to fix all the minutia without really exploring what matters most, what will really change the direction of that ship. So in the VA work, we have this story that Tracy Gaudet tells, which I think is a beautiful example of this. There was a VA patient who had type 2 diabetes, and she went in to see her doctor every 3 to 4 months for her hemoglobin A1C and her LDL cholesterol check. And she would go in and feel somewhat punished, like she wasn't good enough. Your hemoglobin A1C is a little high. Are you eating those vegetables? You haven't lost as much weight as we'd like, right? She felt punished, didn't feel good. And then she said, that's not what I want these smart people to help me with. That doesn't help me. I want them to help me get to my health goal. By the time I'm 50, I've always wanted to climb Mount Kilimanjaro. So the next time I go in to see my health team, I want them to help me get there. So she went in and she told her doctor, I don't care about my hemoglobin A1C. I want you to help me get to the top of Mount Kilimanjaro. And the doctor initially was set back. Hey, that's not what I'm being judged by, right? That's not the metric I need to achieve, right? But he was willing. He said, okay, She convinced him. We will use our expertise to help you get to the top of Mount Kilimanjaro. And guess what? She got there. And how do you think she felt when she reached her health goal? How do you think her primary care community clinic felt? Did you hear Betty? She made it to the top of Mount Kilimanjaro. Yay, Betty! Everybody feels good. Everybody feels energized. That shifts the whole intention, the whole energy of our work from what's wrong with you to what's right with you. And that energizes us because we're addressing what matters most in people's lives. Powerful. Now, we worked with our IT staff and UW Health leadership, and you can now put in our problem list, still called a problem list. I hope one day it's not called a problem list anymore. But you can put their health goal. Just put patient goal in the problem list. And the cool thing about this is that even if you have a 50-item list of what's wrong with you, this will float to the top. So the next time you go into my chart, you can see, hey, there it is, climb Mount Kilimanjaro. That's what I want my health for. And then that shifts the whole energy of what we do. So the cool thing about this salutogenic, health-oriented process is we're all experts in it. Doesn't matter what you do in your clinic or your profession, we can all be experts in facilitating health. That's not so with disease. We need more focused education to manage disease. But health unites and disease segregates. And that brings us together to do this work. And this is what we're going to do today. We're going to explore this for ourselves. We're going to practice mindful awareness. We're going to share our knowledge. We're going to co-create. We're going to get a massage. You're going to do a little coloring. It's okay if you color outside the lines. There's no real expectations here. We just want to come together and dream and co-create. How do we do this together in a new way that really honors what we want most for ourselves and for those we serve? So what do you want your health for is what we're going to explore.